Well, there's two separate things so on the one hand, the government did shelve the AstraZeneca vaccine when it was found to be linked with heart problems. They didn't know that. It took, it was a rollout. You're saying these vaccines are harmful. We don't know the scale of the problem. All drugs carry a risk. Are you not in danger of inflating the fears and inflating misinformation or fears about vaccines in general? We don't really know for sure where the truth is on what the levels of harm is. No one does, because the data is such a mess. So you can't say that, people lied or they're covering up. All you can say is there is harm, which is expected with any vaccine, and we are learning more about them.
First of all, Lucy, I don't think anybody has lied as far as I'm concerned. I think mistakes have been made. I think that we need to acknowledge and have a bit more humility. Stephen Hawking said, I said ancient wisdom teaches that evil is rooted in ignorance, but what's worse than ignorance is the illusion of knowledge. When it comes to those questions you've asked.
You're talking about people covering up and not admitting the dangers of these vaccines. And I'm saying...
So there's a psychological reasons for that. So it's called willful blindness, Lucy. So this is when human beings turn a blind eye to the truth in order to feel safe, reduce anxiety, protect prestige and fragile egos, etc. Okay. And to answer your question, you're saying we don't know. No, Lucy, let me finish. Lucy, let me finish. You asked me the question, so let me answer it. You said we don't know about the true harms of it. Technically, you can say that about anything. But the question is, what is the evidence and what is the level of evidence? Okay. And when you look at the COVID vaccine, and this is one of the main reasons that was cited for what happened in America with ending the investments in the mRNA vaccine technology, is the highest quality level of evidence is a randomized controlled trial. You know this, we've talked about this already when it came to the vaccine. That reanalysis was done by independent scientists of very high caliber, one of the world's top epidemiologists, Sander Greenland, the associate editor of the BMJ, Peter Doshi, and Joseph Freeman, who's actually now one of the most senior advisors in the NIH, as a lead scientist. They reanalyzed the original trials, and from grind zero, from the beginning, you were 2 to 4 times more likely, they found in their analysis, to have serious harm from the vaccine, at 1 in 800, than to be hospitalized with COVID. That was replicated in Norway separately. They didn't know about this. Norway actually came up with a figure of 1 in 1,000, where doctors specifically were making the diagnosis of vaccine injury or through hospitalization or serious harm. Okay, so there's a replication there.